Are you having steamed broccoli sex or sweet potato pie sex? This might be the reason why your libido is so low. For women over 40, especially in perimenopause and menopause, low libido is very common, but it's rarely caused by just one thing. I'm Dr. Janet, a board-certified obstetrician gynecologist, a medical doctor, an intimate health coach, and hypnotherapist. For more than 20 years, I've been helping women over 40 with their intimate health during perimenopause and menopause. In this video, I'm going to walk you through the 10 most common causes of low libido. And these are things that I've seen in the women that I've worked with. And I'll tell you what steamed broccoli sex is and how it might be hurting your sex drive. Before we jump in, make sure to subscribe to this channel and share this video with someone that you know needs this information. When you subscribe to this channel, it not only helps you, but it helps those other women who need this information to get the information and get the help that we all need and deserve. Okay, so let's jump right in. Coming in at number 10, hormones. This is one of the biggest reasons why our libido changes during perimenopause and menopause. At this stage, we see a significant drop in the hormone estrogen and a more gradual decline in the hormone testosterone. And both of these hormones play an important role in desire, arousal, and overall sexual responsiveness. If you're also experiencing things like irregular periods, hot flashes, or changes in your libido, hormones may be playing a role. While hormones might be causing you to notice some of the changes in your libido, they're often just one part of the puzzle. Kind of like the tip of the iceberg that brings those symptoms up to the surface. And in most cases, there's really more than one cause or one underlying issue that is contributing. That leads us to number 9, medications. There are a number of commonly prescribed medications that can significantly impact or affect our libido and sexual desire. Some of the most common ones are birth control pills, SSRIs, or selective serotonin reuptake inhibitors. That's a mouthful, but those are a class of antidepressant medications. Then there are beta blockers, and these are commonly prescribed for blood pressure problems or heart conditions. Opioids, which are used for pain management. Benzodiazepines like Ativan, which are used for anxiety. And among all of these medications that I just mentioned, the SSRIs, the antidepressant medication class, this class of drugs is particularly well known for its effects on sexual function. Studies show that between 25 and 73% of people taking SSRIs experience some form of sexual dysfunction, including decreased libido, difficulty with arousal, and difficulty reaching orgasm. These medications can affect the brain chemistry involved in desire and arousal. And this can make a really noticeable difference in your interest in sex. So if you're dealing with low libido, it's going to be important to take a very close look or a closer look at the medications that you're currently taking. And this is not about stopping your medication on your own. I would recommend having an informed conversation with your healthcare provider to find out what your options are and to find out what the best combination of medications and practices are best for you. Coming in at number 8, past sexual experiences. If your past experiences with sex have felt unsafe, pressured, or obligatory, you may have learned to associate sex with discomfort rather than with pleasure. And this could include obvious experiences like sexual abuse or assault, but it can also be more subtle. For example, feeling like sex was something you had to do to maintain a relationship, going along with sex when you didn't really want to, not feeling emotionally safe or fully able to express what your needs were, having a partner who was not attentive to your pleasure, or experiencing pain, discomfort, or disconnection during sex. Over time, your brain and body start to link sex with stress, with obligation, or even with threat. And when that happens, your body does exactly what it's designed to do. It will shut down your desire. It will shut down your libido as a form of protection. Now let's talk about this in a little analogy. Are you having sweet potato pie sex or steamed broccoli sex? Now what I mean by this is if I'm eating steamed broccoli, I'm doing that because I know it's good for me. Now I happen to really like steamed broccoli, but part of why I eat it is because I know that it's good for me. It's healthy, it's something I should be doing. And for a lot of people, it's not particularly that good. It's fine, and maybe some days it's seasoned a little bit better than others, so it's okay. But most people aren't licking the bowl with their steamed broccoli. And most people aren't asking, let me get thirds and fourths servings of this steamed broccoli. But if you give me some sweet potato pie, now we're talking. I'm enjoying that. I am savoring every bite. I'm asking, when can I get another slice of the sweet potato pie? I'm asking for it. I'm excited about it. It's the same with sex. If the sex that you're having is not that pleasurable, if there's unwanted pain, if you don't feel connected to your partner, you may simply just be having a normal response to something that's just okay, or even unpleasant. But if you're having sex that feels good, that you're excited about, that feels comfortable and connected, and you're still dealing with low libido, now that's something we want to look a little bit more deeply into. So the first question to ask is, how is the sex that I'm having? Is it actually worth having? Is it worth getting excited about? Is it worth asking for? Something to think about. Coming in at number 7, muscle and joint pain. If your body is uncomfortable, stiff, or in pain, it can directly affect your interest in sex. Something as simple as getting into certain positions can become uncomfortable or difficult to do. And that alone can take away from the experience and over time decrease your desire. As we move through perimenopause and menopause, changes in estrogen can affect our collagen, our cartilage, and our joints overall. This can lead to decrease in our flexibility, increases in stiffness, and more frequent aches and pains. And that's especially if we're not staying physically active. There's something called the musculoskeletal syndrome of menopause. And this refers to a group of symptoms including joint pain, muscle aches, stiffness, and reduced strength as our estrogen levels decline. So there are real physiologic changes that are happening inside of our bodies. It's not just we're getting older. There are changes biologically that are causing these musculoskeletal symptoms. And if your body is anticipating pain or discomfort, it's really easy and natural for desire to decrease. This is where movement, exercise, activity, strength, and flexibility can make a really meaningful difference in your sexual experience. Coming in at number 6, religious and cultural conditioning, especially guilt around pleasure. Many women were raised in environments that emphasize giving service, self-sacrifice, often with very little room for personal pleasure. And this can show up in a lot of different ways. We've got purity culture, being taught to delay gratification, or the idea that sex is something to avoid or suppress, or only engage in under very specific conditions. Being taught to wait until marriage before even allowing yourself to think about sex is an example of this. Do the right thing now and eventually you'll be rewarded later. It's a later, not now mentality where pleasure is postponed. We begin to learn that pleasure is something that you have to earn through effort, through performance, or by being perfect. And for a lot of women, there is an underlying message that sex is shameful, dirty, or somehow inappropriate. And over time, this can become deeply internalized. So even when your life circumstances change, so for example, if you were told to not think about sex, don't do anything around sex until you're married, you might get married, your circumstance might change. And if pleasure is something that you've learned that you need to suppress or it needs to be earned, even if you want to feel desire, there may be a part of you that resists it. it can be very difficult for it to happen and to come online naturally. Number 5, chronic stress and survival mode. Many women over 40 are managing multiple roles: career, family, relationships, responsibilities, often doing it all without enough support. And over time, this keeps you in a constant state of stress and survival mode. And the part of the brain that's responsible for desire, pleasure, and receptivity does not function well when you're focused on managing stress and getting things done. When you're in survival mode, when you're chronically stressed, your brain prioritizes problem solving, planning, responsibility, and keeping you safe. It does not prioritize pleasure. So even if you want to feel desire, you literally cannot, because your mind is focused on keeping things running. And for Black women and other marginalized women, there's often another layer of chronic stress related to bias, microaggressions, and systemic pressures. All of this contributes to a nervous system that stays activated. And when that happens, your libido and desire can absolutely tank. So clearing this particular intimacy block is about getting out of survival mode and moving into a state where pleasure is possible. Number 4, vaginal dryness. This is very common in perimenopause and menopause and is largely due to decreasing levels of estrogen. Estrogen plays an important role in maintaining the health of the vaginal tissue, keeping it plump, elastic, and well lubricated. As estrogen declines, the vaginal tissue can become thinner, drier, and less flexible. This can lead to decreased natural lubrication, reduced sensation, discomfort, and often pain with sex. And if sex doesn't feel good, it's natural that you'll lose interest in having it. This is actually a part of a broader condition called the genitourinary syndrome of menopause, or GSM. The genitourinary syndrome of menopause refers to a group of symptoms that affect the vagina, the vulva, and the urinary tract system. And that includes things like vaginal dryness, burning or irritation, pain with intercourse, urinary urgency, or the sense that you have to use the bathroom and you have to urinate, or recurrent urinary tract infections. This is not something that's just in your head. There are physical changes that are contributing to this issue. So if you've been to your healthcare provider with urinary tract infection symptoms and all of your cultures are coming back negative, there's no signs of infection on the tests that they run, but you keep on having these issues, it may be the genitourinary syndrome of menopause at play here. So if you have this experience, you want to make sure that you're talking to your healthcare provider about the options. And there are options. It's very treatable. That includes over-the-counter lubrications and moisturizers, as well as prescription therapies. And these are things that can significantly improve comfort and restore a more pleasurable experience. And when that pleasure returns, your desire and libido can too. Coming in at numero 3, number 3, resentment. And that's resentment towards a current partner or even a past partner. Resentment is one of the fastest ways to shut down that desire. If there are unresolved feelings, whether it's emotional hurt or lack of support, feeling unappreciated, or carrying the weight of a relationship, it's very difficult to move into a space of openness and receptivity. For many women, this shows up as feelings of pleasure being one-sided, carrying most of the emotional load within a relationship, not feeling seen, heard, or valued, or holding on to unresolved hurt from a past relationship. Even if you're no longer with that partner, even if it's been years since that partner, those experiences can linger and affect your current situation. It's important to realize that desire and libido don't exist in isolation. They're very connected to how you feel emotionally and in your relationships. If there's tension, frustration, or disconnection, you may not feel safe or even motivated to engage intimately. This can also affect self-pleasure. If there's unresolved resentment tied to past experiences, It can interfere with your ability to fully relax and access pleasure, even when it's on your own. Addressing resentment is often a key step in restoring desire. Coming in at number 2, sleep problems. Sleep problems are very common in women over 40 in perimenopause and menopause, and it has a direct impact on our libido. Research shows that up to 40 to 60% of women in perimenopause and menopause report sleep disturbances, including difficulty falling asleep, staying asleep, or waking up feeling unrefreshed. And it's not just about feeling tired or feeling refreshed. Sleep plays a critical role in hormone regulation, mood, energy levels, and brain function, all of which are essential for desire. When you're not sleeping well, your body is more fatigued. Stress levels are going to increase and hormonal balance gets further disrupted. And on top of all of that, common perimenopausal and menopausal symptoms like night sweats or hot flashes that are occurring at nighttime and nighttime awakening can further disrupt your sleep, which will then impact your libido. So if your sleep is off, your desire and libido are likely to be off as well. So improving your sleep, whether through lifestyle changes and sleep hygiene, addressing hot flashes, or getting specific treatment for insomnia issues, these can have a meaningful impact on your energy, your mood, and your interest in intimacy. At number 1, negative body image and self-image. This is one of the most powerful and often overlooked factors affecting libido. As we age and move through perimenopause and menopause, there are natural changes that occur in our bodies. Changes in the way fat is distributed in our bodies, changes in our hair, skin, and often our overall appearance. And along with that, many of us are carrying long-standing beliefs about aging, about attractiveness, and about our worth. You might think things like, I'm not attractive enough anymore. I'm not good enough to date. I'm not the type of woman my partner really wants. And those beliefs can directly affect our libido and intimacy. Research shows that women with more positive body images report higher levels of sexual desire, arousal, and satisfaction, while negative body image is strongly associated with lower libido and avoidance of sexual activity. And 85% of women report some level of body dissatisfaction. And I want to take a moment to acknowledge another challenge for many women, especially for Black women. There is this additional layer of colorism and early messaging about our skin tone and our worth. Studies have shown that darker skinned women are more likely to experience lower self-esteem and internalize negative beliefs about attractiveness due to societal bias and underrepresentation. These messages are often absorbed at a young age, long before we have the tools to question them. This conditioning about beauty and worth can shape the way that we see ourselves, often in ways that we're not even consciously aware of. I know in the work that I've done with my clients with darker complexions, nearly all of them have had some underlying lingering shame that they had learned on a subconscious level. So many of us are not even aware that these things are happening under the surface, and we're not aware that there are these beliefs that are guiding and directing our sexual function today. That's why it's important that we not only focus on our physical health and behavioral change. We have to examine the beliefs that we hold about our bodies, about our beauty, and about our worth, and let go of those messages that were lies and never true to begin with. Learning to truly embrace your body and love your skin tone and feel proud of your hair texture and realize that our so-called flaws and imperfections are beautiful and are what make us distinctively human. In my work, I've seen that when these internal blocks are addressed, desire can genuinely open up and flow. And many women find that they're able to experience pleasure in ways that they never have before. Because when you feel safe in your entire body, in who you are authentically, when you understand your value and that you're inherently worthy of pleasure, your libido and desire not only return, but they can flourish. If you're a professional woman over 40 and you're over it, you're tired of dealing with symptoms like low libido, hot flashes, sleep problems, or just not feeling like yourself, and you're ready to get your pleasure, your health, your relationship, and your life back on track, then click the link in the description to learn about the system women over 40 are using to navigate this transition, and to learn how you can fire up your desire, leave those symptoms in the past, and design a life of intimacy and pleasure that is built to last. Thanks for watching, and I will see you soon.